This is a 13-year-old diagnosed with ODD. She has been diagnosed since age 9. I'm just gonna go ahead and like read through it. I'll let you guys do it that way, so that way everyone can get the information. So she was adopted. There was evidence of parental drug use while bio mother was pregnant with her. She was also adopted with her bio sibling at 19 months old. Older sibling stated that she was always left in the crib, so possible neglect there. Child experiences defiant behavior with very little physical aggression or property destruction. She's very argumentative and makes verbal assaults, as noted there. There's no cussing with her. She doesn't really use foul language because she knows that is a behavior that is not appropriate or allowed. However, she does say things like, I hate you, you're Taylor mom, not my mom, 13-year-old girl stuff. Behavior is generally ignored from parents. The behavior during the incidences is verbally aggressive and highly confrontational. Even if mild, the biggest issue is that it is so like it recurs so often. When I am with her without the parents present, she is a different child. With the parents present, she is very on edge, very combative, those sorts of things. So ultimately, like, the arguments are occurring multiple times a day and they last several hours per incident. The mom feels that it is due to her not getting what she wants or losing privileges, and the child has mentioned not feeling okay to walk away from the situation, and this is possibly due to the consequences occurring really on in the argument. So once she knows that if an argument has started, she's going to lose access and privileges to things, and so then she kind of gets the mindset at this point where it has been so regular that it doesn't matter how it is handled, what happens in the argument, she knows she's going to lose it. So she's just, I don't care. And that's her response generally, I don't care. I don't care. So working with them, I created a rules of fighting document, and this was very extensive, done between the both of them. Both had input, both got to say, and understand that whatever is added into it is going to be followed by both parties. This was trying to like create a little more fairness for them, so that way whoever had an issue with like something happening within the argument, they could say, hey, let's bring it back to our focus here. Yeah, so it's in trying to encourage fair fights and give the ability to walk away and calm down, because that was the biggest issue, is that the child is having trouble regulating herself while she is in that heightened state in the argument. So trying to help encourage her to walk away, take 5 minutes, say, okay, pause button, come back in a given set time frame that they agree on. A lot of that is, again, just feeling no say or control over the outcomes. Lots of choices being introduced, like you can choose to do this or we can choose to do this, trying to give her some of it, and it's just still getting met with like a lot of defiance right there. So from observation, parenting structure exists around a consequence basis. An attempts at switching to a reward strategy have been unsuccessful. So the parents feel that the giving rewards inhibits internal motivation, and that has been the biggest struggle, trying to create some more positivity in the house. So since they're worried about that internal motivation and everything like that, trying to find some more natural rewards. The child has stated that she really enjoys time with her mom that is not dependent upon anything else. So just, but that even like adding those in at this point has not been really successful, and she's not motivated by them enough. Again, so the child is bucking any system she feels that makes her have to earn a right or a privilege. That has been really a heavy issue, that, so it's like, okay, well, instead of, working towards like, oh, you're going to get your tablet taken away if you don't do this, let's work on, hey, if we get A, B, and C done, then we have tablet privileges. But the issue with that, though, is that anytime there's any other issue, that earned privilege is still taken away. And so the reward gets taken away, which makes it highly unmotivating. Also makes it feel like there's no control for the child. So she feels highly regulated in all areas of her life. She has a camera in her room that records and offers live streaming. She does not change in her room because of this, and I know that is an issue. She feels like she has no control over her life, and it's just highly contentious between her and her mother. That is the hardest relationship within the household. There's also 3 other children, 1 adult child, and then the father in the home as well. So let's see. Yeah, so contentions between the mom and the child exist in almost every realm, including clothing choices. Check daily before school, no makeup allowed, no unmonitored tablet use, blocked access to the internet, highly regulated TV use, and only limited and monitored friends are allowed to hang out with her outside of school, no access to music due to my history of her looking at vulgar songs, again, quote unquote there. All of her writing journals are read and monitored, and this was due to her cursing in one of her journal entries, as well as writing something in a sexual way towards a boy her age at school. So the mother has never done individual therapy and has been encouraged to try family therapy. Though she has not sought it out, there has not been any parent management training done in the house, nor have they sought that option. Again, resources have been given on parental support groups during the first meeting, and she has taken positive parenting classes as well. So parents defend the need for every rule during meetings and have not been willing to loosen or reconsider those rules. That has been one of the hardest things, is trying to meet them where they're at and to try to help them, encourage them in a very light, easygoing manner that does not threaten the control. It is a family and just heavy conflict, and it feels like everybody doesn't know how to put down their weapons and their shields at this point to try to protect themselves and preserve, the situation there. I think a lot of it, honestly, the family, I think a lot of it is out of love, and it's seen out of love. They just are very, stuck right now and kind of in the corner for everybody. Everyone's kind of cornered in this situation. And then I have been encouraging mom to try to give more praise around the house. So if you see a behavior that you like to give that positive praise. The child has actually been a little uncomfortable with it. And she says that it feels very weird and unnatural to her, since that's not something that she's used to. Also, she is very intelligent and self-aware, and she's very reflective on her behavior, her mannerisms, what her mom's motivations are, what her motivations are. And so she's able to abstractly think in those ways. It still struggles with the conclusions and not being able to have any control or change in those. So again, mom is very rigid. It's a very religious family. They do not use corporal punishment anymore. They used to, though, and they said that the child got too big. And so they stopped doing that, which is awesome to hear they stopped. Unfortunately, they did use it, though, and there's currently no problems in school, and she has good grades. So mostly right now, just looking to see what you guys think on everything like that, and trying to work within this kind of really, really rigid system. Right now, the child is actually on hold for services as they look at out-of-home placement options for her. They are looking at some different options. Basically, when I came into the house, they had made it pretty clear that this was a checkbox that needed to get marked in order to get her into a residential facility. And if things didn't change rapidly, that was their option that they were going to go with. However, if they get denied placement, then we will start up again. And I do talk to the mom for about an hour every week still, just to see how things are going and everything like that. So that is what I have. Like I said, anything I've tried, as well as you can read right there, I've been met with, oh, a therapist has tried that, it didn't work. And that is another huge roadblock and barrier that I'm facing with the family, is that anytime I suggest something like that, it is met with, we've tried that, we've exhausted this, we've exhausted that. And so.
Well, first and foremost, thank you so much, Ashley. Huge kudos to you for bringing this case to the group. And you did such a wonderful job presenting a complex case, really, and you provided so much great background. So I know this group is going to have such great feedback for you. Before we get into some of the recommendations and feedback from the hub members, did anyone have any clarifying questions for Ashley about the case?
So I apologize. I stepped off our phone call for a second, and I didn't realize I was trying to figure out the age the whole time that presentation was going on. How old is this person? I just see.
Yeah, 13.
And there's
Uh-oh.
Oh, no, I don't know if that's,
Ashley outside of her.
oh, I think that
Dr.
was
Swagger,
Dr.
I think you're frozen. Yeah.
Try turning your camera off, Dr. Swagger, might help with connection.
How about now? Can you hear me now?
Yep.
That sounds much better. Yep.
Well, excellent presentation. My question was, do you know if she's receiving other services right now other than PBS?
So I also recommended CSED services just to get somebody else in the home. I feel like with everything happening and how high the tension is, more services are going to be beneficial to them. They're in the process of looking at getting into CSED services. Again, they've kind of put everything on hold as they try to find a placement option for her. She also was regularly seeing a therapist once a week.
Ashley, can you help me understand her diagnoses a little bit better?
Yeah, so what I have into my knowledge, ADHD diagnosis, actually, they were told me that it's more ADD. And then ODD at age 9, which was from her primary therapist that she had been seeing since age 9 to 13. So about a 4-year history with that therapist.
Okay, so I didn't miss any, because I guess my question then is, and this is probably a Dr. Swagger question, given her new role, but does she have the diagnoses that would meet criteria for a CSED waiver?
So it's not
And
based.
or residential treatment?
So the CSED waiver is not based on your diagnoses. It is based on your functional abilities and your treatment team needs. She does not meet any criteria for residential placement.
That was going to be my
so-
suggestion.
And so that sounds more like a parent wish to abandon services than a true treatment need for the child. And I seriously doubt she'll be eligible for CSED, especially with the functional success at school. That doesn't really even meet the real bar of CSED, which is at risk of out-of-home placement. Her behaviors, her needs are not really at that level, and she does not exhibit treatment needs that require residential. She needs a safe, secure family environment, which she doesn't have. And so I will, there are many more people on this call that can speak to how to engage families in that work than I, but I also think just diagnostically and while oppositional defiant disorder is a completely legitimate diagnosis, my perspective is it's a garbage diagnosis if you have not attempted to look for other causes. I mean, what you're describing is more attachment and anxious type behavior, almost hypervigilance in some of your descriptions of sort of a trauma-based disorder, attachment-based disorder than true oppositional behavior. And it's in an environment where there are extreme attempts at control that is neurotic in quality and reflects sort of more parent-child dynamic problems and diagnoses. So while certainly ADHD may quite be relevant, oppositional behavior in its own right can happen across many other diagnostic spectrums. And my guess is people did not look much further to the true etiology of that. But that behavior that you described is not truly oppositional behavior. It actually appears to have other diagnostic etiologies. So I think to Colleen's point, I'm not sure that the conceptualization of this as straight ODD is really critical. And this really, is important as we talk about what treatment she needs. Your traditional external controls for kids that are just oppositional really is not going to help. This really needs to be addressed at the level of trust and core attachment to really process and move forward, which Amanda, our PCIT expert, will certainly talk more about. But I will let them do justice to that. But I don't think her diagnoses are complete. And just a couple of other observations that might be worth noting. The medication regimen, it sounds like she's on less ADHD medicine after school than she is in school. And that may be contributing to some more behavioral and listening issues in the home environment that might be challenging to some of the behavior things. So that might be worth looking at. And then I think the other point I just wanted to make medically before we go into what she really needs is this child has a history of in utero exposures. And she warrants true neuropsych testing, not just psych testing, but true neuropsych testing. These children often have very different patterns in how they process information that you can't tell by talking to someone. Lots of times these kids misinterpret visual cues, or they have gaps and deficits in their needs. And it's very challenging to deliver behavioral work if you don't know what their strengths and weaknesses on a cognitive profile is. And so I would absolutely make sure she's had true neuropsych, not psych testing, and make sure recommendation goes through with that in utero exposure she should meet.
To piggyback off of Dr. Swiger's last point with the neuropsych testing, there's a diagnosis that I know is kind of a catch-all, and it is only kind of one piece of it, but I think it kind of, to understand the diagnosis, helps you to understand kind of some of the deficits these children with the in utero exposure. It's not in the DSM yet, but it's way back in that like other conditions of future study, and it's called neurobehavioral disorder due to prenatal alcohol exposure. Did I get that right? Because it's a long one. I often diagnose it. Is that right? Okay, thank you. I often diagnose it as other specified neurocognitive disorder, neurobehavioral disorder due to prenatal alcohol exposure. But it does a nice job of talking about all the pieces that can come with that prenatal exposure and what it can look like. Because when I see them end up at the psychiatric hospital as adults with criminal records, they look like they are ADHD to the max, and that's not really explaining the etiology behind their behavior. But I think that's where Dr. Swiger was talking about the cognitive profile, their visual deficits. And I want to point out, Cheryl typed a message in the chat that I think was really important. She talked about there seems to be issues with the parents understanding developmentally appropriate behaviors versus other behaviors. I think the most concerning thing I saw was the camera in the room. Is there a reason? Like, is there a legitimate reason to have a camera in this child's room?
Yes, I would love to speak on that, because I have also, had asked them, is it something that we would be willing to consider to say like, hey, if X, Y, and Z criteria is met, can we take out the camera and everything like that? Because as the child has mentioned, she feels that she does not have any safe place to go to just exist in her own right. I mean, she has to change in the bathroom just so that way it's not, considered an issue legally. And the parents have like pushed back on that and said that they do not trust her enough. And that's another issue, that's brought up. Like as Cheryl mentioned, the family, everything that happens is this child and her issues that she's causing the family, the stress she's causing this family, the dad's having psychological issues, and it's this child's fault because of the stress that all the constant fighting is causing. But as pertaining to the camera specifically, the mom feels that it is not safe to let the camera go because she's not trustworthy enough to not have that camera. Because at one point she tore up, on one occasion, mind you, her room. When she was very upset, she went into her room and tore down the stuff. And again, when you were looking at, like ODD and everything like that, you're not seeing that much control. She does not cuss. She is able to maintain herself, not to the point where she's going, and those sorts of behaviors. Like she knows what is specifically off boundaries and not allowed, and she's trying to maintain herself within that parameter pretty well. Pertaining to that though, a lot of it is like, oh, I noticed you were on your camera watching something that you weren't supposed to be watching, even though it's on kids Netflix, because there's some drinking in it, yet you went under your blanket for another 10 minutes with your tablet. What were you doing? And she has no access to YouTube. She has no access to Google. She has no access to anything besides the parent approved apps that are put on it. So there's not much that she could have been doing. But because that huge lack of trust is there, to me, the child most likely was just like, hey, I want to go under a blanket. So they got to the point where they were at a stalemate. Nothing could be changed until the child admitted to what she was doing. The child felt she was being honest. So she lost privileges for weeks on end until she would cop up to something that she did not feel she was doing, that there was nothing under there. She was not doing anything. She just felt like going under the blanket. The parents felt that was not accurate because they felt she was hiding something. Why else would you be under a blanket for, 10 minutes? What were you doing on the tablet? That sort of thing. Yes, and that was as mentioned as Swagger. I like that because that's what I was trying to explain to her, is that we can get that internal motivation by pairing it with outside reinforcers. in order to like, because you're still gonna hit that like neurologically, hit that same part, and start creating that association. But yes, as far as that goes, though, the camera in the room, I feel it's a huge issue. It's a huge trust issue because they're showing her that they don't trust her. And they're not giving her any safe place to de-escalate. And that was the other thing too. She said, if I need to calm down for 5 minutes and walk away from a conversation, I can't go to my room. And the mom's like, you can't, I'm not sitting there watching you unless I have a reason to. But it seems like the mom is also hypervigilant in everything. Like she's trying to find a reason to not trust her. She's trying to find a reason to question her. And I've tried to have that conversation with her before saying, hey, unless there is actual proof, bring it up once. If the child denies it, let it go, because otherwise it creates this environment where the child feels like she is on eggshells because something can be misinterpreted rather easily. And it puts her into that predicament with the, but yes, as far as CSAT goes, you guys are right. She does not meet the criteria generally. My work was with CSAT prior to this. And
There's so much going on in this family, and there's so much, there's so much rigidity with mom that, it's creating a lot of the behaviors. And you've talked a lot about, the tension in the home, and it sounds like it's around mom. What's her relationship like with the other family members? Oh, you're muted. Go ahead.
sorry, I was reading Dr. Swagger as I was listening to you. So her relationship with her other family members is also highly contentious. Her relationship with dad, she said that I feel my relationship with my dad is good. I know that he loves me. And I said, well, how do you know he loves me? And she goes, well, he gives me hugs and tells me he loves me. And I said, well, does mom do that? And she goes, well, she'll tell me good night and she loves me when I go to bed. And I was like, well, what about other times? But her other siblings that are in the house, she is definitely the black sheep. She is one that's causing all the issues. And so mom has it as, well, her siblings see how she talks to me, how she treats me, how she bullies me, and they get defensive and they're starting to push her away because of that behavior. So she has literally been just ostracized by every angle, and that relationship with dad is disintegrating pretty quickly. And it's getting to the point where he is even starting to join in and be contentious, like with mom alongside it. So she does not have a good relationship with her adult siblings. She does not have a good relationship with her family, and her siblings are also about 5-6 years younger than her, the next oldest one. So she is not close with them, and they also have been made to feel like she is the problem and causing all the family issues.
Yeah, I think before I go into talking a little bit about this, I just want to tell you, Ashley, I think you have done an amazing job with this family. Like as I printed this off and I was writing like my recommendations besides things, but as I'm like writing down questions and recommendations, you're answering it throughout, like when I flipped over, you're answering it on the other side and you're already going in that direction. Like you're doing an amazing job with the resources you can with this family. I think this is a very complex case. I mean, like Dr. Swagger said, you have in utero exposure, and like Dr. Lillard kind of contributed with that, how difficult that can be within the thought process, and even to recognize, right? And I think especially for families who have adopted children, because a lot of the times children can physically develop, but not social emotionally, right? They have some of those gaps in different areas. And so they see them as these 13-year-olds, but then they're emotionally not meeting that criteria in different areas, but yet they are in other areas. So they have a really hard time meeting them where they're at. I actually take, I'll show you guys real quick. Let me share screen. I actually take, so I take this, I take Piaget's theory. So I have this little handout on my desk. And then I take Erickson's 8 stages when I work with families. And I actually have them try to identify, like, where do you think she's at in these stages, right? And then because it gives them a visual of these steps that are needed to move forward. And I mean, Ashley, if you had to place her, where do you think one of her steps is missing?
So she's definitely functioning at a lower a lower level. I think right now, honestly, a lot of it is between around the toddler to preschooler stage.
Yeah, she's trying to gain some autonomy, but she's shamed a lot for
She is
just
heavily
being a
shamed.
13-year-old, right? Like just wanting privacy and wanting her own space. But also, she doesn't have any trust for her family. And so I would even still place her down here a little bit. And when you have families kind of place them there, right? They gain a little ownership and they're able to see like, okay, I can see her functioning like a 13-year-old at these times, but yeah, she's really struggling with some of this, right? And so then they're able to kind of meet them where they're at. And that's a real important piece because her dysregulation is huge. That's a theme that comes throughout your presentation, and her inability to regulate her own emotions. Her wanting to isolate is totally appropriate, right?
Age
When you
appropriate.
have kids like Dr. Swagger saying, well, for one, it's age appropriate. A 13-year-old totally wants to isolate. But like Dr. Swagger saying, some of those gaps in development, I mean, you have to have the ability to co-regulate before you regulate. She can't co-regulate.
No,
It
she can't
doesn't sound like she.
Well, and then that's what I've tried to push for is non-contingent time. That is not, but there's not a great enough relationship at this point to have like non-contingent connection time with her family or her siblings. And so
Yeah.
there's not a lot of co-regulation happening.
No,
And
so
then
she's not able to do it. She's not able to, and so she's given these expectations that she physically can't do. And so then she's failing time after time. And where's that motivation, right? Like, so now she's labeled as a bad kid. And this is what we see happen all the time within foster children, right? Because they don't have that ability to regulate their emotions. And then what happens is then they learn they're having bad behaviors. So I must be a bad kid. And then that's kind of where that self-esteem
internalize it.
comes from. Then they're labeled as bad. And I think that's really difficult. It's really super difficult. So there are two books that well, Colleen, I know the one you love is the No Drama Discipline. So Dan Siegel's No Drama Discipline, but that kind of comes from the Whole Brain Child. And that talks about more of trauma treatment in early childhood and how important. And Dan Siegel actually kind of talks about like, as parents, we want our canoes to be in line going down the river, right? On one side, there you go. Look, Colleen's got both of them. I got them too. Colleen's representing with them.
I may or may not have used my professional funds to buy it, but really I needed it myself.
That works. But what he talks about is like on two ends, you have like, on one bank, you have rigidity. On one side, you have chaos when parenting. You want to keep your canoe in the middle, because if you're too rigid, you're going to create tantrums and behaviors. If you're too chaotic, you're going to have kids that don't follow any direction. They can't listen to authority, right? Like, so you want to kind of keep that canoe right there in the middle. And I think that sometimes can be hard for parents. The other concept that I think is very difficult for parents to accept is that you have to give respect to get respect.
Yep.
She's not getting any respect as a 13-year-old. It's like that. She's like they're holding on to everything she's done wrong every time she does something, instead of moving on and moving forward at this as like a developmental piece. And so I think that could be a lot of work around. What I would love to see done with this family is, but it's not our goals, it's about their goals. And it doesn't sound like they're very motivated. And it sounds like you've been really trying hard to motivate them. So, but they have alternative motives, right? Like, so if they're coming in just as a checkbox, then they're not going to get where you need them to get. And how frustrating for you as a provider to be put in that position. But I totally respect you wanting to prepare for them coming back, knowing that they're not meeting that criteria. But I think it would be amazing for mom and her to do some attachment work. I think that would be super beneficial, but mom would have to buy into that. And it doesn't sound like that would be something that mom's really bought into right now. I think helping them to build that bond and attachment is going to really hit that first step of trust versus mistrust, right? If she was left in a crib by herself, for hours on a time, she was not getting her needs met. So she does not trust caregivers, primary adults, right? We don't know what else she experienced at that time. She was exposed in utero, so we know that she has a heightened sensitivity to ADHD and defiance. We know that her percentage is higher at that time. So it can create, also that exposure can create, so it actually increases, depending on what she was exposed to, it increases different volumes in her brain that causes her to dysregulate faster. And so even if her, her amygdalas, a lot of the times amygdalas are typically enlarged, and the area where, emotional responses is. So what I teach parents all the time, because a lot of the times parents, especially of like 13-year-olds, right, they want to talk about it. They want to process it. They want to get it out. They want to talk about it. No, just let them calm down first. Like you're saying, let her go to her room and calm down. Because I'm going to share this too, because this was part of my PowerPoint, but it was just if you, I teach this to parents. Oh no, hold on. What did I hit from current slide? Okay, so if you teach them to flip the lid, right? So what I teach parents about this is, like, we're talking about, so the amygdala, let's say our thumb is the amygdala, that's the part that I'm telling you is a little heightened in volume sometimes when you have in utero exposure. And then this part of the brain too as well. And that's the emotional response. And so your brains develop from the back forward. So this is your spinal cord. This is that emotional response. This is that amygdala. And then this is that top part of your brain, right? That's completely under construction from 5 under, but even from 5 to 24, it's still under construction, right? So you even still have some holes missing in your amygdala, which is like your staircase connecting the two. And so what happens for kids who have been exposed in utero and then had childhood trauma along with dysregulation, like ongoing dysregulation, this is one of the reasons why they dysregulate so much, is everything that happens to them. So they're already like a tea kettle, right? Because this part is already like a little fattened. So they're already like a tea kettle, like ready to pop. So sometimes these are the kids that are losing control faster. But what happens is when something happens that could trigger some of that underlying trauma, it hits that emotional part of their brain. And so then they flip their lids faster. When they flip their lids, they no longer can make any decisions to what's going on. We have to calm them down before they can think through anything. And so really what we teach parents is let's get their lid back down before we revisit this, right? And so we don't want them to come at them while their lids are flipped, because nothing's going to happen. Like if you think about when you're really mad, how much progress do you make? Like I don't know about you guys, but I make none. Like I have to calm down, right? So we all flip our lids, but it just so happens that she's a little predisposed to flip her lid sooner and harder, right? So sooner and more intense. And so that can really help with regulation. Like if her and her mom can start, regulating, but it sounds like mom's anxiety is like triggered at that time, and she's wanting to fix it and figure it out, and that doesn't help. Like she needs to give her some space. But I think that's a bigger conversation.
I just wanted to do I just
Go
want to
ahead.
do a quick time check. We're at 12:39 here, and I know you still have your didactic too, Amanda. And Mandy, I saw you had your hand raised. I wanted to make sure you got your question or comment in as well.
It sounds like we all agree that the situation's not going to be super successful because the parents seem overbearing at minimum. And I heard you mention that they're a very religious family, and I'm racking my brain here thinking, are there any kind of services where there's a psychologist who specializes in religious homes where they can, in their particular area of where, what their belief system is, to maybe say, hey, even our belief system would have some leeway? Because it sounds like they might not be taking a lot of advice or wanting to go to any kind of therapy or counseling because it might not be in line with what they think is right. So to them, the child's completely out of line, which really everything you've said outside of, it sounds pretty normal to me for a teenager, like, to have a camera on them 24/7 and to be reading her diary because you said there was a curse word in her diary. Like some of this stuff is so far afield that I just can't see how the child could possibly be successful. And from what I'm reading in the things here, it says that another one of their children, of the bio children, is in residential already. So like this is issues not just with the child. Like it sounds like there's a lot of parenting issues that maybe, is there something like that where they can say like, hey, they specialize specifically in your belief system that they might
And
be
I
open
have like,
to?
yeah, so I've tried to like find more like resources and everything like that, like specifically for that. The father is very high up in the church, and so that is another issue, that they think they have the knowledge basis to handle this. And she's actually, the mom is in the social working field, so it's like they're very like that is one of the hardest things, is that they feel that they have the knowledge and that they're privy enough to be able to handle this. But I mean, can you imagine the both sibling, like, and she knows that she doesn't shape up fast enough, that she is gone, and that puts a lot of pressure. That puts a lot of pressure on her.
Actually, I think you just hit on the more important part to me. I actually am not even sure this is religious. I actually wonder if this is triggering their own sort of stability in their community as pillars of authority. And that maybe we're triggering, their own trauma. There was a comment from Cheryl about even their own biological child was sent to residential. I actually wonder, and this is a very hard thing to get people to kind of acknowledge, but I almost wonder if they're struggling with their success as parenting in general. And it's very much moved
Projecting onto
into
the
feeling that, sending them away is my only option, that they have accepted, because it's too hard to think that they could be viewed as failed parents. And that's a very, very difficult place to go around, but I'm not sure it's religious at all. I'm not aware of a true religious belief system that supports watching your children, dress. I mean, I think we're hitting more on our cultural standing of in position of authority in our community and being looked up by others, but struggling in our own home. And that's a very hard thing, but I imagine it's triggering maybe some trauma reaction in the family. And so I wonder if viewing this and educating this as a trauma response to the family, instead of just oppositional control behavior, could be really a door into those child level needs. That's really an interesting bit to me.
Yeah, I would 100% agree. And so Dr. Swigert is just kind of like leewayed into right where I was going. So what I would recommend for you that I typically do with families, and this can kind of give you some starting ground, right? All of these other pieces behind to kind of gear you up towards it. But as providers, we know that you're not going to make any leeway until, they have motivation for change as well. You can't work harder than the family or you're going to exhaust yourself. But one thing that you can look at doing, and this is what I do with families, is I develop a hypothesis. So you can develop a hypothesis around this case. And then so like an example hypothesis, and this is just an example you can work on. And I'm happy, like if you wanted to brainstorm with me, I'm happy, reach out to me, we'll set up some time. But if your hypothesis might be the child would, I don't know, she would reduce her anger if her and mom got along better, right? Like that could be a hypothesis. But part of your hypothesis is delivering that to the family. So it has to be something that you're comfortable saying, like, okay, here's what I think is going on, right? So when they come back to you and they tell you everything else that's going on, you can develop a hypothesis from this and say, okay, this is what I think is going on. What are your thoughts? Once the family buys into that, you can help them kind of gain some objectives of how to manage this, right? So how do we help this? And so exploring that with them will help them buy into their own treatment, right? And so you can provide some recommendations, but this way they're kind of buying in, they're developing their objectives and goals. And then that way they have a little more of a buy-in than us saying like, this is what's going on. And this is, so it's really building that relational framework so we can move them forward. Does that make sense?
And that's the advice that I'm needing, because trying to get buy-in from the family, and like I said, it has been like walking on eggshells, so that way I'm not upsetting mom. She's very, every time I mention anything, it is, oh, well, we've tried, like, it is very, very combative and like pushed back. And then trying to like walk it. So like, hey, like, I'm your friend in this, like, we're gonna figure this out together, while also not neglecting the child and making her feel like I am siding has
Right.
been a very hard challenge, because I don't want the child to feel like she's not being seen or heard in this, because it's a lot for her to handle. But I really, really appreciate everybody's advice and everybody's like words of wisdom and everyone's like basis of knowledge and everything like that has been actually like wonderful to explore and to hear from. And I'm very, very appreciative to hear from everybody.
Thank you for an awesome case. I mean,
Yes,
I thought
fantastic.
like I had fun going through this. Like and like I said, I'm reading and I'm writing stuff on the side, and then I flip over and I'm like, oh, she's got this. She was there. She already did this. Like, so you're on top of it. I think you're doing a great job with a very difficult case.
I'm going to leave my email for everybody. I think it's already listed in the thing, but I'm going to leave it here as well. So if anybody has any follow-up ideas or anything that they want to reach out with me, like, we're in this, I would love to hear it. I appreciate everybody brainstorming with me and thinking of everything.
I just wanted one little point for you. I know you were concerned about her like alienating her while you're gaining kind of a relationship with parents. Do you spend time with just her?
Mm-hmm. Yes.
You sound like she's very she's kind of aware of situations and very intelligent and insightful. I might just like let her know that part of, improving the relationships is got to be your relationship with her relationship with mom, but your relationship with mom. And that may include, finding mutual goals for everybody. And it might make her feel less like, oh, okay, she's talking to mom to help move me where I need to go.
Mm-hmm.
And I might in some ways just kind of be, treat her like the 13-year-old that she is and give her some of that autonomy in your relationship to help model for mom what to do too.
Yeah, I thank you, Colleen. I totally agree with that. I do that with all of my preteens and teens, because I think it's important for them to have that. And they are your primary patients, right? So always
Exactly.
making them aware. Like I had one yesterday. I said, hey, just so you know, I like to give families like just some updates. I said, but if you say absolutely not, I will not. And so just giving her that control, like this is still your session.
Well, and that's what I've been trying to do, is like create that like funness with the child. Like, whenever I say, hey, are you comfortable with me sharing this to mom? And everything like that. Like our stop fighting plan was Operation No More Fights, like lots, like creating it fun and like, we're in this together. Like, how can we tackle this? And trying to get that teamwork camaraderie feel to relay to mom and her has been the hard part. Like, yeah, we're in this together now. Let's all